Om Swastiastu. We are from SGDB1 PSSKPD 2020 second semester. In this occasion, we are going to present our student project entitled Erythrocyte Index and its Interpretation. Here's our group members. My name is Sandy and I will explain the background. Erythrocytes as a component of blood have some characteristics such as containing hemoglobin. Hemoglobin has a function as a transporting agent of oxygen and carbon dioxide. Therefore, hemoglobin is very important because if the level is dropping, the body's function will be disturbed. That's why there is an erythrocyte index as a part of complete blood count test that was introduced by Winthrop in 1929 to explain the amount of hemoglobin content, the size of erythrocytes, and the appearance in microscope. Erythrocyte index used to provide significant clinical information and diagnose anemia, also determine it based on its morphology. There are several types of erythrocyte index, and there is a technique that used to count the erythrocytes, and it also requires expertise to interpret erythrocyte index. So, erythrocyte index needs to be studied and discussed, especially for medical students. Next. Therefore, problem formulation of this student project is, what is erythrocyte index? What are the types of erythrocyte index? What is the clinical significance of erythrocyte index? How to count erythrocytes? And how to interpret erythrocyte index? Meanwhile, the purpose is to describe what erythrocyte index is, to describe the types of erythrocyte index, to describe the clinical significance of erythrocyte index, to explain how to count erythrocytes, and to explain how to interpret erythrocyte index. Also, this student project has a benefit like give general and specific information about erythrocyte index and disclose how to count erythrocytes and how to interpret the erythrocyte index. Next.
Hello, my name is Mira, Wrycza, and I'm going to explain about the definition of the red blood cell index, starting from the red blood cells. So first of all, the red blood cells, or as we know, erythrocyte, is a cellular component of the blood. Red blood cells have a biconcave shape and doesn't have a nucleus. It is surrounded by a membrane that consists of lipids and proteins. Red blood cells also contain hemoglobin, which is necessary for the transport of oxygen and carbon dioxide. Hemoglobin carries oxygen from the lungs to the tissues and carries carbon dioxide from the tissues to the lungs. Besides of being a transporting molecule, hemoglobin is also a pigment that gives the red color to the cell. That's all from me. Next.
My name is Nindya Krisnadewi and I'd like to explain about RBC index. Red blood cell or RBC index is a part of complete blood count test. RBC index was introduced by Winthrop in 1929 to give an explanation about the size and the hemoglobin content of red blood cells. RBC index is used to give information about the amount of hemoglobin content and size of red blood cells. It also shows the appearance of red blood cells microscopically and gives significant clinical information. RBC index examination is used as a screening test to diagnose anemia and determine anemia based on its morphology. RBC index can be calculated by two methods. They are manual and automatic. To calculate the RBC index manually, we have to know about the amount of hemoglobin, hematocrit, and red blood cell counts. Meanwhile, to calculate the RBC index automatically, we can use hematology autoanalyzer. Next.
My name is Williem, and I'm going to explain about type of RBC index. First is mean cospular hemoglobin, or usually called the median amount of hemoglobin in every erythrocyte that is found in the blood specimen. Red blood cell analysis is used as a method to calculate the MCH level. In adult, 27.5 to 33.2 picograms per cell is considered to be in a normal range for MCH level. Numerous factors can contribute to the low level of MCH, which is usually caused by the lack of hemoglobin production, usually in patients that suffer from thalassemia. Next is mean cospular volume, or MCV, in short term, that can be defined as the midpoint value, which calculates the average size and volume of an erythrocyte. This type of measurement is often to find out the etiology of anemia and its classification. Next is mean corpuscular hemoglobin concentration, or usually called MCHC, that can be defined as the midpoint of hemoglobin concentration or content of hemoglobin per volume that is found in erythrocyte. Normal MCHC in adult ranges between 33.4 to 35.5 gram per deciliter. Next is red blood cell distributions with, or usually called RDY, RDW in short term, give information about various sizes of erythrocyte and usually used to identify anemia and other medical conditions, for instance, thalassemia, diabetes mellitus, and cancer. Next.
My name is Sadam. I would like to explain the clinical significance of red blood cell index. Red blood cell index examination is usually used to see the type of anemia. Based on the morphology of red blood cell, anemia is classified based on the size and color of the red blood cell. Red blood cell index is very important in classifying the morphology of anemia. Based on the size of the red blood cell, anemia can be classified as anomocytic, macrocytic, and microcytic. In microcytic anemia, it was found that the microcyte appear small on the optical property, making them appear hypochromic on the blood smear, while the hemoglobin concentration was still in the normal range. Next. It should be pointed out again that an evaluation of anemia is not complete without the careful examination of well-prepared peripheral blood smear. However, it was found that the red blood cell index was not helpful in identifying conditions such as the entry of red blood cells, such as malaria parasite or membrane abnormalities, such as perocytosis, that might be causing anemia. That's all from me. Next.
My name is Widya, and I would like to explain about MCV, or mean corpuscular volume. So mean corpuscular volume, or MCV, is a method that used to calculate average number or the red blood cell volume. On the other hand, it can also definition as authentic size of the cell. The result will be presented in as femtoliters or in cubic microns. The normal number of value of MCV itself are around 80 to 96 femtoliters for both women and men. The MCV itself is the most practical number or value in the RBC indices to find out the category of the anemia. The following formula is used to measure the number or value of MCV. The formula is hematocrit in percentage, calculate by 10, and also divide by RBC count in millions per cubic millimeters blood. That's all from me. Thank you.
My name is Dewa Fony Prema Shanti, and I would like to explain mean corpuscular hemoglobin, or MCH. Mean corpuscular hemoglobin, or MCH, is the approximate amount or average weight of hemoglobin in each red blood cell in the body whose levels can be known through a complete blood test or complete blood count. The formula in calculating MCH is calculated by, and the formula can be seen on the screen, and it is a measurement of the average weight of hemoglobin in individual erythrocyte. Through the formula, after got mean corpuscular hemoglobin result, compare it with normal MCH level. Normal MCH levels can in adults are about 27.5 and 33.2 picograms per red blood cell. The normal value may vary from lab to lab depending on the machine that uses it.
Hello, my name is Gede Raka Samudra, number 23. Mean corpuscular hemoglobin concentration, or MCHC, is the average amount concentration of hemoglobin per unit volume of erythrocyte and is counted by dividing the hemoglobin by the hematocrit. Normal age 32 to 36 gram per deciliter, mean corpuscular hemoglobin concentration were invented by an 8 via 2012 hematology system with autoslide. The change of RBC formation on MCHC, because increasing MCHC went along with the continuous specific decrease in RBC deformability during stress tension. The MCHC is a sensitive indicator of hemoglobin deformation, as it shows the degree of hemoglobin saturation in erythrocytes regardless of the amount of formed elements. These are the pictures of normal MCHC, low MCHC, and high MCHC. With the formula of MCHC is HB or hemoglobin in gram per deciliter per PCV in percentage counted by 100. Okay, next.
My name is Winnie Chandra, and I'm going to explain about the red cell distribution width. Red cell distribution width is a method to review the size variance of the red blood cells. The result of RDW is equal or suited with the MCV deviation standard. The following formula is used to measure the number or value of RDW. A normal value for RDW is between 11.5 until 14.5%. Most physicians state that RDW is one of the most functional red cell indices in determining diagnoses such as anemia, coronary artery patient with high blood pressure, or an early nutrient poor intake. RDW is most functional when assessed along with MCV. Next.
Hello, my name is Darren Junior, and I will explain about the interpretation of red blood cell indices. Next. The interpretation of red blood cell indices can provide useful information for health workers in diagnosing blood-related diseases such as different types of anemia. One example of red blood cell indices is MCV. Next. If a patient's MCV value measures below 80 femtoliters, then the patient might be suffering from microcytic anemia, where the red blood cells are even smaller than white blood cells. On the other hand, if the MCV value is above 100 femtoliters, then the patient might be suffering from macrocytic anemia, which is divided into megaloblastic and non-megaloblastic anemia. However, normal value of MCV doesn't always indicate disease-free conditions. The patient might still be suffering from normocytic anemia, where the value of MCV is normal but has low hemoglobin and hematocrit. Next. Another example of red blood cell indices is MCH. Next. If the value of MCH falls below 27.5 pictograms, it might indicate iron deficiency anemia. On the other hand, the high value of MCH might indicate that a patient is suffering from B12 vitamin or folate deficiency anemia. Next.
My name is Karina, Nityani Kumar, and I'm going to be explaining about the next two RBC indices. Mean corpuscular hemoglobin concentration, or MCHC, is traditionally calculated by dividing the hemoglobin quantity by the hematocrit. MCHC is reduced or hypocystic in some type of the microcytic anemia, in which the degree of loss of hemoglobin is more than loss of cell volume, but normal or normocytic in microcytic anemia, which hemoglobin is increased, but the cell size is also proportionally increased. MCHC is elevated or hypocytic in hereditary spherocytosis and sickle cell disease. The next one is red blood cell distribution width, or RDW, is a measure of the variation in the diameter of the red blood cells. A high RDW occurs in conditions such as iron deficiency anemia, or IDA, B12 deficiency, and folate deficiency. The RDW would be expected to be normal in anemia in chronic disease, or ACD, and hemoglobinopathies. That is all from me. Thank you. Next.
Hello, my name is Dewi and I will explain about the conclusion. Red blood cell is a cellular component of blood that has a biconcave shape and surrounded by a membrane consisting of lipids and proteins. Red blood cell index is a part of complete blood count test that gives information about the size and hemoglobin content of the blood. There are 4 types of RBC index, which are mean corpuscular volume or MCV, mean corpuscular hemoglobin or MCH, mean corpuscular hemoglobin concentration or MCHC, and red blood cell distribution weight or RDW. There are 2 methods that could determine the RBC index, which is manually, required data hemoglobin, hematocrit, and erythrocyte data, and electronic using a hematology analyzer. The interpretation of red blood cell that classifies erythrocyte and diagnose blood-related disease could provide useful information for the health workers, which are could show different types of anemia, identified thalassemia, identified as the sickle cell infection, and the last, identified anemia in chronic disease ACD. Next. These are the reference that we use. Okay. This is the end of our presentation. Thank you for your time and attention. We apologize if we make any mistakes. We will end it with Paramasanti. Om Santi 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 Om.